Is TRT for life? What are the most common testosterone replacement therapy side effects? Welcome to this channel. I am Dr. Steven de Vos, the lifting dermatologist, and this is my bro science hunting partner Danny Bossa. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please like and subscribe.
Click the bell button to get notified.
I also invite you to join my other YouTube channel, The Lifting Dermatologist. The link you can find in the description of this video. Welcome everyone to the TRT and Hormone Optimization YouTube channel. Today with me is Danny Bossa. Hi Danny.
Hey Steven, how are you?
And I am Dr. Steven de Vos, the Lifting Dermatologist. And today we are covering some TRT basics. And the first question I had for Danny is a very common one. Is TRT for life, Danny?
If you're on TRT, then yes, it is for life, ideally. You can't view this as, let's say a guy taking steroids. You can't view this as, I want to bulk up and I'm going to take some drugs that are really harmful for the body and I'm going to take them for a given amount of time. And then after that given amount of time, I'm going to stop and I'm going to take some other drugs to get my natural production going back, and then be healthy for a while. That's steroid cycles, and those are things that people will do, not me, for example, but the people will do in these types of cycles. When you're taking TRT is for health. Usually you're taking it either because you have a deficiency or you have symptoms of low testosterone that you want to resolve. This is usually something that people do primarily in their 30s or 40s and up from there. There's people that say, I just want to try it out. I want to try it out and I want to see what effect it has on me. Does it help? And yes, you can try it out, but you have to understand that your body is regulating the amount of testosterone you have in your body. So the second that you're introducing any exogenous testosterone, when I say exogenous, I mean testosterone coming from the outside, be it by injections, be it by a cream, be it by whatever method of administration. When you're introducing this, the body's going to see that there's more testosterone than usual, and it's going to realize at one point that there's really no need to be making any, because there's this constant flow of testosterone coming in. So we call that suppression or shutdown. Basically, your testicles will stop making testosterone and your body is going to start to rely on the testosterone that is coming in from the outside. So if you're going to do, let's say, a 6 or 8 week trial or a 3-month trial. So I'm going to try this stuff for 3 months and I'm going to see if it helps. Well, hopefully at the end of the 3 months, you're going to say, I feel much better now than I did when I started. And if that's the case, you'll just stay on. The problem is if you try it for 3 months and then you realize like, hey, this isn't really helping the thing I have. Maybe that thing I had nothing to do with testosterone whatsoever. You have to understand that at this point, you are suppressed. Your body now is not making any. So if you suddenly stop and you say, okay, the 3 months is gone. I've tried it out. It's not for me and I'm going to stop. Or maybe I don't like giving myself injections. Or maybe, I don't like applying the cream to my scrotum twice a day, or the whole thing's just a big pain in the ass type thing, and you want to stop. That's fine, but you have to understand now that your levels in your body are just gonna plummet, and you're probably not going to feel very good. And there's not really some magic pill that you can just take that just gets your natural production right back up to where it was. This is a process that will take some time. It's going to take time for the body to realize that, hey, there's no testosterone coming in anymore. I got to start making some. So the signal is sent from the brain to the testicles to start producing it again. And this whole process could take time. Like it could take literally several months until your natural production is back. Even when it is back, there's no guarantee that it'll be back at 100%, production, if you will, of what you had before you started. You might only have 90% or 80% or 85%. There's no real way to tell what it's going to be. So you have to keep in mind that if you're starting TRT, hopefully you've got a pretty good idea that your issues could potentially be fixed with testosterone. You've gone through with your doctor at length. Most of the symptoms are pretty clear. And if you do, hopefully it all works out. If you don't, there's a number of things you could be doing. Some people will take stuff like clomid, clomiphene, they'll take tamoxifen, or they'll take HCG. They'll take things, HCG, I guess, would be probably the more popular one these days, is something that you inject and it basically stimulates production. It'll speed that production up and eventually you can wean yourself off.
Okay.
So, for TRT for life, like I said, it's once you're on it, your body is now going to be relying on this testosterone that's coming in from the outside. So you're not going to say, I'll do it for 5 years and stop, because now we're going back to what I just explained. Your levels are going to tank. You're going to feel like crap. Mm-hmm. When I started TRT, I was pretty certain that the symptoms I had were due to low testosterone. And I was right, because when I added testosterone, and I figured out what my dose was, and I figured out the best way of taking it and how often, all this type of stuff, my symptoms all resolved. So there's no way now I'm going to stop, because I'm just going to go back to where I was before, which would be silly. And I knew damn well that if I was going to go down this path, that, really I could never stop, or, because if I did it, it's going to be a process, to say the least. So I've committed to saying, I'm going to be taking this till, probably to the day I die. And it's going to improve my health overall. I'll have a better quality of life. And I really don't see a downside of taking, 60 seconds out of my day to do something, which takes me less time than it takes to brush my teeth, really, just to improve my health and live a great life.
Okay, that was very clear. Thanks. The second thing we wanted to cover today was another search term on YouTube. That is, what are the most common testosterone replacement therapy side effects? And maybe let us do it system by system. So I will ask you if there are, for example, side effects on skin, prostate, and so on. So let's maybe start with the skin, since I'm a dermatologist. Are there any known side effects from TRT on the skin?
Okay, so on the skin, if you're going the injection route, if you are doing, say, subcutaneous injections into the fat, there are some people that will get a nodule. So it's just a localized swelling. I get them from time to time. Because I do subcu injections. It's just a very, very, very tiny bump. Sometimes it'll be a little bit bigger bump, but typically it goes away in a day or two. And it's not really that big of a deal for me. We have seen guys in the group that have had larger ones, sometimes very, very large, all red, swollen.
We have very popular videos on this channel to check out about the subcutaneous nodules.
Yes, we do. And typically what we're seeing is it can be an intolerance or a sensitivity to the type of oil that is being used. So when you're using any type of injectable oil, there's a whole slew of different types of oils that are being used. So there's cottonseed oil and sesame oil and whatever. Perhaps you have an allergy to that specific oil. And as soon as you do, it just swells up and goes nuts. So, if that's happening more than once or twice, and it's happening on a regular basis, sometimes it's not even just a swelling. Sometimes it's just a feeling of malaise, a feeling in general, you just don't feel well. It could be a sensitivity to the oil. You can switch, go from enanthate to cypionate, or if you're on enanthate, so let me use enanthate of a different type of oil or so on. Would be something for you to try. Okay. If you are doing, even if you're doing injections into intramuscular injections, you could also experience the same thing. You don't quite get the nodules that you get when injecting into fat, but you could have some pain, some tenderness, some swelling. And again, same thing. You can maybe try using a different injection site or try using a different oil altogether. Regards to let's say if you want to go the other route, you go with the transcodal cream. There are some guys that apply it, and they we have a video on that, breaks out into a rash. There's the skin just doesn't look well. It's getting itchy. It could be the base of the cream that is being used. You can try switching to a different base. There's Versa base. There's Lipoderm. There's a number of them that can be used, and they're all good. But if you're having issues with one of them, just ask your compounding pharmacy to say, can we switch to a different one entirely, just to see if I still have the same issue.
Okay. Anything about acne? Are there guys that are getting acne from TRT?
There are guys that are getting acne from TRT. If you have never had acne in your entire life, the odds of you getting acne from TRT are probably slim. You got to keep in mind that when you were a teenager, during the time that you would have been prone to acne, that, if you didn't have it then and you had raging levels of testosterone, it's pretty unlikely that you're going to get them by using exogenous testosterone today. take a guy like me that I had a lot of acne when I was a teen, and I'm saying, my face was covered, my back was covered. I'm taking testosterone now, and I do get little, I have one right now. It's a tiny, tiny little thing, but I do get one on my face from time to time. And my back, I do have, I do get them. My back is not completely clear. Mm-hmm. And I find, interestingly enough, it primarily started when I was using HCG because I needed to be fertile because I'm trying to get my wife pregnant for a while. When I was on HCG, that my acne got exceptionally bad on my back. And when I stopped, it went back. But now I literally have acne scars on my back. Mm-hmm. If I increase my dose higher up, and I've had videos of that, of times that I've, just for science, if you will, I wanted to demonstrate if taking more can be better. In my case, it was not better. I just had issues with insomnia. I just felt lethargic. I had no energy. I had no drive. Anytime I was doing that, my acne did flare up more than before. I was getting more. Now that I'm back at my regular TRT dose, it's pretty much under control.
Okay.
And this is the same.
We have made videos on this channel about acne on TRT, the treatment and the prevention. So be sure to check those out as well. I will make some links in the description of this video about all the videos I mentioned here.
Mm-hmm. Also, just very quick, it's same thing for hair loss, guys. If you're prone to hair loss and you start taking testosterone, it could exacerbate it a bit. It could speed up that process a little bit more. If you have a full head of hair, don't think that I'm going to start taking testosterone and my hair's all going to fall out. It just doesn't work that way.
Exactly.
It may accelerate it slightly. So this is off topic of the skin, but just saying how TRT can make things slightly worse if you were prone to it previously.
Male pattern baldness, like I have, I would have had it, and I had it way before I started my testosterone replacement therapy. So that's not due to it, but it may accelerate it a bit. But what the heck, who needs hair if you have a body like this? Okay.
Exactly. But with you, there's no real pattern though. It's just one.
No. It is a pattern. It is the typical male pattern baldness. Don't worry.
Okay.
My grandfather without TRT was bald when he was 30. So
there you
if
go.
you're prone to it in your family, you're just destined to have it sooner or later.
There you go.
So next system that we might cover, are there any concerns for heart problems on TRT?
No. So there is a lot of myths going on that if you take testosterone, you're going to get an enlarged heart, you're going to have a heart attack, you're going to have all these types of issues. You got to understand that testosterone and estrogen are cardioprotective. They will actually improve your heart health, improve cardiovascular health all around. You want to have both of these as much as possible. You don't want to be blocking estrogen unless, could there be an exception? Perhaps there could be an exception, but typically you do not want to ever block it because the two of those combined are what's going to make you healthy. So no real effect on the heart in the way that the media might be putting out, like, oh, this guy is taking testosterone and 2 months later he dropped dead of a heart attack. There's a lot of these stories that come out in the media, and when you start to look at the finer details, it gets to be a little funny. A lot of these guys that start on testosterone were obese, these big fat guys and couch potato, and never lifted a weight for maybe 20 years and just ate whatever crap, and their arteries were clogged, and they're just sitting there couch potato, and they're like, you know what, I got to make a change. They say here, my low testosterone issues are, erectile dysfunction. Yeah. No sex drive. Yeah. No energy. Yeah. Yeah, I guess I must have low testosterone. So they go to the T clinic, the T mills, and they get testosterone. So now they're on testosterone and they start feeling better. So now it's like, hey, I got some energy to do stuff. Let's start having sex. Let's start exercising. Let's start doing all this stuff. This is great. But their bodies are just not equipped for this sudden change of activity. Mm-hmm. And next thing you know, they have a heart attack because they're just doing too much. So that does occur, but in a typical healthy guy, let's say like, a guy like me, that I start taking testosterone, there's no way I'm going to get a heart attack from this. Right now I'm taking it. One of the reasons is the cardioprotective benefits that the higher levels of testosterone and the resulting higher levels of estrogen are going to give me. I should live a longer life. I should avoid heart disease. I should avoid all these different types of
For all the new viewers of our channel, we also have a Facebook group with the same channel name, TRT and Hormone Optimization. You can go in there and join, and a lot of studies are posted there into the group, all about estrogen, the benefits for heart, cardioprotective things as well. So go check out those studies in our group. So the next system, Danny, same very common concern, the prostate. What about that? Are there any side effects there?
So the prostate, this is one area that I still have a lot to learn. I can say that we do see at times some guys that are taking testosterone and their PSA levels increase slightly. Also, the guys are taking the transcranial cream, their DHT goes up, their PSA levels increase slightly. It can happen. If you are prone to a prostate swelling, can it exacerbate it a bit? Perhaps. Does it cause prostate cancer? No. That's been completely ruled out. One of the biggest things, again, in the media and the bro science forums was if you take testosterone, you may get prostate cancer. That higher levels of testosterone, higher levels of DHT may cause prostate cancer. That is false. They used to use androgen deprivation to resolve or try to cure prostate cancer. Now they're actually trying to treat it with testosterone. So there's a lot going on now with the way they look at the prostate, and they look at these androgens and how they interact with each other. So I wouldn't worry about developing prostate cancer. If you do, it probably wasn't the testosterone. I mean, I think they say right now that 1 in 4 men will get prostate cancer at one point in various degrees. So it won't necessarily be the testosterone. But again, I have seen guys that their prostate would increase in size slightly, where the PSA up would go up slightly. It has in me. I've noticed that the more I would play with my dose, if I upped my dose, my PSA would rise a touch with it. And if I lowered it drastically, my PSA would lower a touch. Is it coincidence? Perhaps, but I've seen it. I've logged every single blood test for the last 4 years, and I would always see those things kind of stay in some kind of equilibrium. Do I have any issues with prostate? No. I can wake up in the middle of the night, go to the bathroom, and I pee, no problem. So if you're on testosterone and you're having issues with prostate, you're having difficulty peeing, you're pain, whatever it is, definitely go see a doctor. So far, I have not. There's very few people in the group that report any issue with prostate at all. It's not really a question that comes up. So okay. That's my answer there.
Okay. Any other side effects of testosterone replacement therapy that are common, Danny? What have we not talked about?
Side effects. So you got to keep in mind that when you start introducing this into your body, your hormone levels prior to starting were in a certain place, and your body was used to that certain balance, if you will, whatever that balance was. If you're going to start introducing testosterone, you're now going to completely upset that balance. And it will take some time for your body to figure things out. It's going to take time for your body to realize, okay, this is how much testosterone is coming in. This is the levels. Okay, I don't need to make any more. We're going to shut down natural production. And then that level will kind of, become consistent. And then the rest of the supporting hormones will eventually kind of fall into some kind of a balance, fall into some kind of equilibrium. During that adjustment process, there are some guys that report feeling better right away, which is great. And there's others that don't. I was one of the guys that don't. I felt worse before I felt better. So some of the symptoms, you can have water retention. You can have some kind of bloat. You might have some kind of insomnia, because it does act a little bit as a stimulant in the body to a certain degree. Water retention, bloat, insomnia. Some guys can get nipple sensitivity. They can get swelling. What's called gynecomastia. With some of them, it'll swell a little bit and then it'll kind of go back down. With others, if they have any type of issues, that swelling could continue and get out of control. I'm still trying to learn what all the mechanisms are behind gynecomastia, because I actually developed it when my estrogen was very low, even prior to starting TRT. And now that I'm on TRT, that swelling has reduced significantly from where it was. Other issues could be side effects. Are we only talking negative side effects, or is it positive?
Yeah, I
side
was thinking
effects?
the same thing. All the other effects I'm thinking about are just positive. Libido, more muscle mass, burning fat easier, having better sleep, being less depressed. So all the other effects are really positive things. So I think we can round this one up here, Danny.
Unless you can think of a side effect, a negative side effect that I haven't mentioned. Okay, I haven't had a negative side effect in so long, so they're kind of out of my head at this point.
So for the viewers, if you have any side effects that you might relate to your TRT treatment, let us know in the comment section under this video. Contact us in the Facebook group with the same channel name, and let's talk next time about more basic TRT stuff, Danny.
Very good. Thanks, Stephen.
Thank you. Thanks for watching. Give it a thumbs up and see you next time.